I'm so happy to be here today to say a few words as we work together to conquer this global health and economic threat. We must go beyond protecting those within our own borders and must step up to meet this global challenge. We have a collective responsibility to make sure that no one is left behind, which is why Canada is supporting the COVAX facility and advanced market commitment that will help ensure that vaccines are distributed quickly and fairly around the world. Because Canada's recovery depends on a global recovery. We all need to be part of the solution. That's why Canada is contributing $440 million in additional funding to the COVAX facility, including $220 million more to the advanced market commitment to provide doses to the least developed countries around the world. And we will continue to work with all of you to find a way through this pandemic together.
Yesterday marked a grim milestone in our shared fight against COVID-19. 1 million people are confirmed to have lost their lives to this new virus. The real number is certainly higher. Thousands more are fighting for their lives in hospitals all over the world. Individuals, communities, and economies have been gripped by fear and uncertainty. Science is giving us solutions in the form of new tests, therapeutics, and hopefully a vaccine. But science and solutions will be ineffective without solidarity. That's why we say solidarity, solidarity, solidarity. The Access to COVID-19 Tools Accelerator harnesses the power of science and partnerships to develop solutions and deliver them in a spirit of solidarity. Already the ACT Accelerator has delivered impressive results. Earlier this week, we reached agreement to make 120 million new rapid tests available to low and middle income countries. We have secured courses of dexamethasone, the only medicine shown to reduce the risk of death so far for up to 4.5 million patients in lower income countries. And COVAX is supporting the development of 9 vaccines with more in the pipeline. We already have 167 countries who will benefit from the COVAX vaccine facility, representing over 70% of the world's population, and the list is growing every day. All of this has been achieved with $2.6 billion of startup funding. Now it's time to realize the full power of the ACT Accelerator. The current financing gap for the ACT Accelerator stands at $35 billion. That's less than 1% of what G20 governments have already committed to domestic stimulus packages. To put it another way, it's roughly equivalent to what the world spends on cigarettes every 2 weeks. Fully financing the ACT Accelerator will help to control the pandemic, restore confidence, and stimulate the global recovery. Frankly, this is not a financial challenge. It's a test of solidarity. This is a moment for saying no to nationalism and yes to our shared humanity.
The world is on the brink of a great scientific achievement. A COVID-19 vaccine will likely be ready by early next year. In fact, we'll probably have more than one vaccine ready. These vaccines will allow us to save millions of lives. They'll also have another enormous benefit. They'll allow us to develop a plan for the world to globally eliminate COVID-19. To achieve this goal of global elimination, we need 3 things: the capacity to produce billions of vaccines, the funding to pay for them, and the systems to deliver them everywhere. The world's low and lower middle income countries are home to nearly half of the global population. Because they don't have the purchasing power of the wealthy countries, they risk not getting nearly enough doses. Unless we do better, they'll only be able to cover 14% of their people with a COVID-19 vaccine. The only way to eliminate the threat of this disease somewhere is to eliminate it everywhere. The solution is not shaming the rich countries that are doing the natural thing of wanting to protect their people. The solution is to vastly increase the manufacturing capacity so we can cover everyone as soon as possible. It's been amazing to see these private companies agreeing to expand drug-making capacity by using each other's factories. We have a number of agreements like this, but we need even more, especially for the vaccine. That's why I'm thrilled today to announce a new joint agreement signed this morning by 16 pharmaceutical companies and the Gates Foundation. In this agreement, the companies commit to, among other things, scaling up manufacturing at an unprecedented speed and making sure that approved vaccines reach broad distribution as early as possible. The next component we need for global elimination is the funding to pay for those vaccines. The pharmaceutical industry has already made significant commitments in this area as well. The companies involved in the agreement are committed to using donations, foregoing profits, and using tiered pricing to make their products as affordable as possible. So another element here is that we need public funding to pay for these vaccines for all countries. And this is where the ACT Accelerator comes in. It's supported by Gavi and the Global Fund. Both organizations have spent 2 decades becoming experts in how to buy and deliver vaccines, diagnostics, and drugs to developing countries. The United Kingdom has donated enough money for the accelerator to purchase hundreds of millions of vaccine doses for poor countries. I want to thank Prime Minister Johnson and the Foreign Secretary for this amazing leadership commitment. And I want to encourage other countries to do the same. Finally, even when we have the manufacturing capacity and funding lined up, we'll need to strengthen health systems to achieve the broad coverage to deliver the vaccine and monitor for outbreaks. In doing this, we can take the lessons we've learned from the ongoing effort to eradicate polio. With the right diagnostics, health workers can also sound the alarm if a future disease jumps from bats or birds or any animal to humans. In other words, we can also be building the system that will help reduce the damage of the next pandemic.